Djibouti fights deadly malaria wave with GMO mosquitoes. An Anopheles stephensi mosquito obtains the bloody meal from the human host. CNN, genetically engineered mosquitoes have been released in the tiny Eastern African country of Djibouti to combat a surge in malaria infections caused by invasive vector. The initiative, started on Thursday, comes as Djibouti, one of Africa's smallest countries with just over a million residents, grapples with the dramatic increase in malaria cases, skyrocketing from just 27 in 2012 to more than 70,000 in recent years, according to the WHO. The health body attributes the spike of the arrival of the Anopheles stephensi, an invasive Asian mosquito species that transmit deadly disease. The mosquito species has also been detected in Ethiopia and Somalia, Djibouti's neighbors in the Horn of Africa, posing a significant regional threat. Unlike most malaria-transmitting mosquitoes in Africa that breed in rural areas, Anopheles stephensi thrives in urban environment, intensifying the public health challenge for predominantly urban Djibouti. This mosquito poses a huge threat to our fight against malaria, said Gray Pedersen, CEO of US-owned biotechnology firm Oxitec, which developed the gene-modified mosquitoes released in Djibouti. Anopheles stephensi evade conventional tools are resistant to insecticides and daytime biters, reducing the efficacy of a bed net, he said. Djibouti Health Minister Ahmed Lobli Abdilli told CNN that his nation was trying out the new technology developed by Oxitec and believes that it could be a game changer in reducing malaria spread. We are in the pilot phase, but we believe in the technology. We are sure it will be the game changer, Abdilli said. Using mosquitoes to fight mosquitoes. Dubbed a method that uses mosquitoes to fight mosquitoes, Oxitec's genetic technology targets female mosquitoes, which are predominantly responsible for malaria transmission. The technique involves the releasing genetically engineered male mosquitoes into the wild, which then mate with females. The introduced gene prevent female offspring from the survivor into adulthood, effectively reducing the population of malaria transmitting mosquitoes. Male mosquitoes do not bite and therefore cannot transmit malaria. Pedersen said the Oxitec's genetic technology, which is funded by the Bill and Melinda Gates Foundation, has been effective in reducing other mosquito-borne viral diseases such as dengue fever in other parts of the world. Our technology is already proven to reduce populations of dengue spreading Aedes aegypti mosquitoes by upward of 95% in urban communities in Brazil, and we are committed to delivering impact in urban communities in Djibouti and beyond, he told CNN. We are still at the early stages of this program, but we are hopeful of the impact this can have in driving down malaria-spreading mosquitoes, he added. Although the rollout of genetically modified mosquitoes in Djibouti is only the second in Africa. The idea is drawing more interest in the continent. In 2019, a team of scientists released Africa's pioneer batch of gene-modified mosquitoes to gather data on the potency of the technique in Burkina Faso, where malaria is a leading cause of death. According to Vector Control Research Alliance, target malaria, the mosquitoes released in the West African country were genetically modified to be sterile, so it can mate but cannot produce offspring. It added that they estimated 14,850 gene-modified male mosquitoes were released and 527 were recaptured. After recapturing them, the researchers found that genetically modified mosquitoes were less mobile than their non-transgenic siblings and had a lower survival rate. The Alliance said of these findings, adding that the second trial phase was being planned in the country. Uganda's President Yoweri Museveni announced in early January that his country is partnering with Oxitec to combat malaria. Africa bears the brunt of the global malaria burden, accounting for 96% of malaria deaths worldwide in 2021, according to the World Health Organization.